With resisted range of motion, since our client is already lying in a prone position, we'll do all of the prone resisted motions that we can, starting with extension. What I will have you do, please, is just lift your entire leg off the table and hold it there. That's okay. Good. And now we'll apply that downward pressure, one hand above the knee, the other hand below, and push up into my hand for a 1, 2, 10 count and relax. Good. Always, when releasing the resisted range of motion, help your client down and make sure that they are fully relaxed before moving on. The next resisted motions we then perform will be medial and lateral rotation of the hip, which again we will do in two positions, one with the hip extended, and when we rotate our client face up, we will have the hip in a flexed position. So to perform resisted medial rotation, the foot is going to be coming towards us. To perform resisted lateral rotation, the foot will be moving away from us. Now this can be quite complicated for your client to try and figure out how to do, so hand position and communication is essential. With hand positions, do not grip onto the ankle like this, because if I were to say press into my hand, what does that mean? My hand is covering the entirety of her ankle. So press only on the side you want your client to press into, and then tap. Do you feel where I'm tapping here on the inside of your foot? What I'd like you to do is try and pull your leg into my hand, okay? So right there where I'm tapping, right when I tell you to, go ahead and meet my resistance for 1, 2, 10, relax, good. That's resisted lateral rotation. Now you feel out here where I'm tapping your hand on my hand on the outside of your foot? Yeah, good. When I ask you to, I want you to push your foot into my hand. Go ahead. Meeting my resistance for 1, 2, 10. Relax. Good. That's resisted medial and lateral rotation of the hip. While we have our client in a prone position, we will perform resisted flexion and extension of the knee. Remember, the quads and hamstrings affect both the hip and the knee, so we must test both the joints with resisted range of motion to assure we are testing all of the muscle fibers. To begin with, we're going to bring the knee we are testing into a slightly flexed position. I prefer somewhere around 45 degrees and no more, maybe less. Certainly, you will never go into 90 degrees. In fact, I would encourage you to never even approach 90 degrees. The reason being, if we apply resisted contraction of the hamstrings and we're approaching 90 degrees, there's a high likelihood of causing a cramp in the hamstrings. So again, backing off to somewhere between 30 and 40 degrees. To start with, I'll get you to hold your leg in that position. That's comfortable, right? Good. And if they say it's comfortable, we know that we can now move into our true resisted range of motion. As we know with resisted range of motion, you will hold it for a full 10 seconds. So I will get you to bring your heel towards your bum, pressing into my hand, meeting my resistance for 1, 2, 10, and relax. Good. Bring that leg down. So as I say relax, I'm making sure to hold on to the foot. If I simply say relax or I let go before I say relax, she might end up bringing her leg up or there will be a cramp. So we communicate clearly what we want them to do and make sure we support them through the entirety of that motion. The next motion I'm going to work on now is extension of the knee. So the same thing, bringing that knee into about 45 degrees. You can hold it there, that's okay. Good. Now I'll wrap my hands around the ankle and I want you to try and straighten your leg, please. Meeting my resistance for 1, 2, 10, and relax. Good. Excellent. And if you would please, I'd like you to roll face up for me. Good. Now we can finish off the last of our resisted range of motion of the hip in this prone position, noting that we've only had to flip our client twice. One from face up to face down, or from supine to prone, and the next from prone back to supine. Let's do resisted flexion of the hip, of which there are two positions that will test slightly different muscles. To begin with, I will get you to lift your leg just off the table like that and hold it there. You feel okay? Good. I'll place my hands one above and one below the knee and press into my hands. Now meet my resistance Excellent. 1, 2, 10, relax. Good. With the hip in an extended position, we are certainly testing all of the hip flexors, but a little bit more emphasis is going to be on rectus femoris. Shifting into our second position of the hip. So we will bring the hip and knee into 90 degrees of flexion. You're okay to hold there. All right, I'll take one hand around the inside of the leg, just pressing proximal to the knee. The other hand will support. And when I ask you to, I want you to try and bring your knee up into my hand, meeting my resistance. Okay, go ahead. Meet my resistance for 1, 2, 10, relax. Good, and we'll bring that leg down. Note to being clear on my communication, meet my resistance. That's a very strong motion in some people. So you need to make sure that you are setting the level of contraction so your client doesn't overwhelm your own capacity, potentially leading to injury for yourself. Let's now do resisted medial and lateral rotation with the hip in a flexed position. So in this position, communication and hand positions are also important. We're going to begin with resisted medial rotation. So what I'll have you do when I ask you to is you're going to try and bring your leg like this. So bring your foot out, okay? So I'll take the leg back into a neutral position. Make sure I'm maintaining that vertical axis of the femur. And now please meet my resistance. Bring your foot out, push it into my hand for a count of 10. 1, 2, 10. Relax, good. And once we've fully relaxed, we'll do the opposite motion, which what I'll have you do in a moment is you'll try and bring your leg in like this, okay? Making sure that the femur is straight, hands in proper position, just proximal to that knee. Other hand is going to be on the calcaneus, and go ahead, press into my hand for 1, 2, 10, relax. Good, and we'll bring that leg down. Resisted medial and lateral rotation, which leaves us with our final motions. That's resisted abduction and adduction of the hip. We're going to begin with resisted abduction of the hips. So we start by bringing the legs together, and then I'll place one hand on either side of the leg superior to the knee. Now we ask our client to press into our hands. Go ahead and press out into my hands. Good, and we'll count from 1, 2, 10, relax. It's important that you monitor and notice what part of your hand you are using. For myself, it's comfortable for me to stand like this, pressing into the radius on both sides, but that might cause discomfort for your clients. And if that is the case, shift your hand position. You might press your hands like this, and again, in a moment, meet my resistance and press out into my hands. Go ahead, press out. Good, 1, 2, 10, relax. So play around with your hand position, see what's comfortable for you, but also make sure you see what's comfortable for your client. Let's now finish off with resisted adduction of the hips. So, to start with, I like to use a yoga block. It's much easier on myself and easy on the client. So we'll just place this yoga block just in between the knees, and what I'll ask you to do when you're ready is squeeze into that yoga block gently, okay? Go ahead for 1, 2, 10, relax. Okay. Now, the reason I prefer to do that is the other option is we will use our own arms. So bringing my arms superior to the knee, my fists together, and squeeze your legs into my arms, please. 1, 2, 10, relax. Just as effective, however, it can be uncomfortable for your client's legs as they squeeze into your ulna, and it can also be uncomfortable for you as your hands and arms are squeezed together. We've now made our way through active, passive, and resisted range of motion of the hip. Again, I reiterate, make sure you do your very best to flip your clients as few times as possible. We know the general principle is to perform the tests and range of motion on the unaffected side first, followed by the affected side. What that might mean is you perform all of the motions on the unaffected side and then all of the motions on the affected side, having your clients flip a grand total of 4 times. And that's not ideal. You would perform the active and passive motions with your client in a supine position on the unaffected side and then the affected side, and then flip him into a prone position and perform active and passive motions on the unaffected side and then on the affected side. And then you would perform resisted motions in a prone position on the unaffected side and then the affected side. And then you flip them that last time, and you guessed it, perform the resisted range of motion in a supine position on the unaffected side and then follow by the affected side. So we still follow those same principles, doing our very best to flip our clients as few times as possible. Hey, thanks for watching, and don't forget to subscribe. If you would like to learn more about orthopedic assessment, click the link in the description below and register for a free training on orthopedic assessment, where I'll take you through my entire assessment process beginning to end, step by step, and teach you my 3 secrets to get more out of every session with my clients. I'll see you there.